We would like to start Veterinarians Without Borders with a land acknowledgement. Veterinarians Without Borders members, staff, volunteers, donors, and supporters live and work on the traditional territories of many Indigenous people across North America. The traditional stewards of these lands who've been living and working on them for thousands of years. Our head office is situated in the unceded and unsurrendered territories of the Anishinaabe Algonquin Nation, whose presence reaches back to time immemorial. My name is Kristen Rodriguez, and I'll be the moderator for today's webinar. So welcome to our World Rabies Day webinar. World Rabies Day is observed annually, actually on September 28th, which is tomorrow, and serves as a global platform to raise awareness about rabies and advocate for prevention and control measures. So to mark this day, today we've invited a multidisciplinary panel of One Health specialists and colleagues to help us answer the question, how can innovative animal health delivery models lead the fight against rabies? Specifically, we're going to explore the synergies between rabies control, livestock productivity, and sustainable community health within a One Health framework. So during this webinar, we do encourage your active participation. And after the speaker's questions, we'll open the floor for question and answer session. So you can choose to wait until the question and answer session to submit one of your questions online, but also feel free to submit them during the presentation, and we'll refer back to them during the Q&A session. So to begin, at Veterinarians Without Borders, for those of you who are familiar with us, we do embrace the One Health approach, which highlights the interconnectedness between human, animal, and environmental health. By working across disciplines, from veterinarians to community health workers to environmental scientists, we strive to build sustainable solutions that tackle rabies amongst other health challenges, particularly in remote and underserved regions. So rabies control has a positive impact on livelihoods and community well-being, particularly in rural and underserved regions where we work. So here are a few ways, key ways it makes a difference. So one, rabies control protects livestock and livelihoods. So rabies controls helps reduce the risk of rabies spreading to livestock, safeguarding rural economies that rely on healthy animals for income, food security, and agricultural productivity. Rabies control also helps lower healthcare burdens. So by preventing rabies transmissions to humans, especially in regions with limited healthcare access, rabies control reduces the need for costly medical treatments like post-exposure prophylaxis, easing the strain on both families and healthcare systems. Rabies control also helps to enhance public health infrastructure. So it helps control efforts, rabies control efforts such as vaccination campaigns, create opportunities to strengthen veterinary and human healthcare services, particularly in underserved community, thus improving overall community health and resilience. Rabies control also fosters local empowerment. So by training animal health workers and engaging in communities in rabies prevention efforts, these programs help build local capacity, which fosters leadership and strengthens the community's ability to manage other health and economic challenges. Finally, rabies control helps sustainable development. So controlling rabies allows communities to focus on broader development goals, such as improving education, livelihoods, and food security, contributing to long-term social and economic progress without disruption caused by rabies outbreak. So our goal today in this webinar is to explore how innovative animal health delivery models like community animal health workers and mobile vaccination clinics are overcoming barriers to rabies control. So we'll also look at how these models are improving both animal and human health, particularly in rural and remote areas, and how they're advancing global health efforts to eliminate dog-transmitted rabies by 2030. So we're excited to hear from our distinguished panelists who bring years of experience in rabies control to One Health initiatives. Our first speaker, Katinka de Balogh, will discuss rabies as a model disease for One Health approach, emphasizing the vital role of community members, including animal health workers and local champions, in raising awareness and expanding dog vaccination efforts, moving closer to the goal of eliminating dog-transmitted rabies by 2030. Then we have Scott Zari, who will discuss innovative approaches to delivering animal health services in rural, remote, and Indigenous communities across North America, focusing on community engagement, successful case studies, and leveraging technology to create sustainable solutions. And finally, we have Johnson Limo, who will discuss Mao's innovative One Health approach to rabies control in Tanzania, which integrates community One Health champions to lead local efforts in raising awareness and educating communities. He will also highlight the impact of mobile rabies vaccination clinics in reaching remote areas, ensuring both immediate disease control and long-term community capacity to maintain healthier animals and human populations. So without further ado, I'm going to introduce Katinka de Balogh, who's a former senior animal health and production officer at the FAO, and the Food and Agriculture Organization of the United Nations. So Katinka is a veterinarian with a doctorate in tropical parasitology from the University of Munich. She also specialized in tropical animal production and veterinary public health through advanced studies in France and the Netherlands. Katinka spent 9 years working as a district veterinary officer and lecturer in both Zambia and Mozambique. And from 2002 to 2022, she worked at the Food and Agriculture Organization of the United Nations in Rome, serving as a focal point for One Health and coordinating efforts with the World Organization for Animal Health and the World Health Organization. So Katinka now brings her extensive experience to VWB Canada Board of Directors. And so with that, I would like to pass it over to you, Katinka.
Thank you very much, Kristen. Thank you for this introduction. I will just share my slides and welcome to you all for this really nice webinar and greetings from Rome. I'm just checking if it's, yeah, can you see it? Yeah, okay, thanks. So as mentioned, we are presenting today on how innovative animal health models can lead the fight against rabies. And as mentioned, I will be looking a little bit more at community and community animal health workers, specifically in the fight against rabies. So as just as a reminder that rabies is a real public health problem, but also has impact on animal production, especially when livestock becomes infected by rabies, often either by dogs or by wildlife in some parts of the world. But if we look, most of the cases actually occur due to dog bites. And this is especially in Africa and Asia. We find that also 40% of the victims are actually children. And yearly, the estimates are that around 59 to 60,000 people die each year of this terrible disease, but that is completely preventable. And one of the best measures to prevent this is actually through dog vaccination. And this is also where my talk will focus on. So in 2050, the international organizations like the World Health Organization, FAO, and also the World Organization for Animal Health, together with the Global Alliance for Rabies Control, developed this global rabies strategy. Before, there were many initiatives. There has already been a lot of work on rabies, but by joining forces and developing this global strategy and having a clear target that to eliminate dog-transmitted human rabies by 2030 helped to kind of bundle all the different efforts and bringing all the stakeholders together. As mentioned before, it's a really One Health disease. It really needs to tackle the different sectors. And the main sectors here are possibly the human health and animal health, but also environment and many other sectors should be part of any rabies control program. But I want to focus on these two sectors. And we know that to stop rabies, we need good surveillance and good laboratory diagnostic. And in many countries, it's very difficult to get samples collected in the field and taken to the laboratories. But often without the good information, it's very difficult to convince policymakers about the importance of rabies. In addition, there is the need for dog bite reporting, as well as information on the public about the importance of wound washing, but also to take post-exposure prophylaxis. And here also in rural communities, in developing countries, often the access to post-exposure prophylaxis that we call PEP is extremely difficult because there is no PEP actually available in many parts of the world. So in the interface between animal and human health, we have this large awareness campaign, and World Rabies Day that started in 2007 has made a huge impact on creating this awareness among the general public, but also among professionals about the importance of rabies and what can be done about it. But also involving municipalities and especially communities is absolutely key in the fight against rabies. Then dog vaccination. People need to know that they need to bring the dogs for rabies vaccinations. Not only dogs, we see also that cats in many places of the world are the ones also transmitting rabies to families and family members. So also to have the vaccination of pets as well as to engage in dog population management. This means, creating responsible dog ownership, for example. But then essential for countries, if we talk with policymakers, they need to have the legislation in place and the political support as well as the financing. And often that is what is lacking, especially the funding available, because when you prioritize, often the economic diseases that occur in livestock often are the ones that are being addressed more by the veterinary services instead of actually rabies, which is more transmitted through the dogs. And the same in the human health side. Rabies needs to fight with other programs like malaria or tuberculosis, or in the case when COVID-19 happened, it was very difficult to get resources and also the possibility to go out and vaccinate the dogs. So we see that often the efforts that have been made have regressed during COVID-19 times. But overall, we find that the communities across the globe, they are the ones that face very similar situations. And these are the ones that carry the biggest burden of rabies because they are marginalized. As mentioned before, they have difficult access to services, to vaccination capacities, to post-exposure prophylaxis. There is poverty, there is lack of information often available, lack of awareness, but also low education levels can lead that people do not know exactly what the disease is. There are many myths around rabies, for example, but also lack of inputs. And here it would be often vaccine or PEP, but also they are exposed to many risks, other risks, but one of the risks is also rabies. So there are many issues that come into play when addressing rabies. And therefore the One Health approach enables to bring also the different professionals and the different sectors together. If we look at communities and community health providers, we find in many places of the world the traditional leaders have a very specific role. They are the ones that often the community trusts. And we have seen traditional healers that heal people, but also animals. They are sometimes kind of the One Health personification, but often they need also to have the right tools and the right information. Like, for example, in Vietnam, we have seen that traditional healers often can provide the wrong information about when people need to go to post-exposure. And involving them in the discussions, in the awareness campaign can help that they become also champions at the community level. And traditionally, we see that the barefoot doctors, these were one of the first kind of government village workers that were linked to the governments that provided services in very rural communities where the normal health services would not be available. And I want to mention here specifically the Alma-Ata Declaration by WHO in already 1978 that brought the whole concept of primary healthcare, taking healthcare to the actual communities, not just providing the health cares in the hospitals that are often located in bigger cities, but actually to bring healthcare and especially preventive healthcare down to the community level. In the animal health side, I don't know if you're all familiar with the rinderpest eradication. And this is the only animal disease that has actually been eradicated, like smallpox on the human health side. So rinderpest was declared, the world was declared free of rinderpest in 2011. And to be able to reach this high level of vaccination of cattle at that time was through involving communities, and something was developed that was called participatory epidemiology. And this is also when the knowledge, the concept of community animal health workers actually started. So we see community animal health workers are often farmers. They're often people within the communities, and they receive a small training, and they are actually able to help the other farmers or other community members. We see the concept, as mentioned, was first developed for livestock, but we see now also the value of it for addressing rabies. And like last year, the concept of dog health champions was developed, and there are projects in Nepal, South Africa, and Sri Lanka. But already, like in 2010, there were the animal health clubs in Sierra Leone, where actually the students got very directly involved with rabies control, and they were also informing communities and providing knowledge to them. I just want to mention here the example of Brazil, where they organized one-day massive campaigns in the whole country. And Brazil is a country with, at that time in the 80s, there were over 100 million inhabitants. And they would mobilize 100 dog vaccinators in one day. So this would mean that they would have teachers, nurses, policemen. They would have all myriads of people in the various communities to actually be part of these massive vaccination campaigns, where over the years between 8 and 14 million dogs were vaccinated in one day in the whole country. And this was extremely successful. So just to finalize my presentation, I want to mention here that it's important when selecting community animal health workers, you know, that you define clearly what kind of profile, what kind of person you want. For some diseases, it's better to have women, like for poultry diseases, often as poultry keepers are female, to have more women selected for as community animal health worker, but also to ensure that there is a harmonized training and there is recognition for the efforts that people make. Normally, the government doesn't provide direct remunerations, but sometimes the communities actually will provide some kind of remuneration or recognition to the people. Also, the legal status. In some countries, vaccinations can only be conducted by veterinarians. And here, this might need some review of the legal status that, for example, veterinarians can supervise other people that have been trained but that are not actually veterinarians. And the World Organization for Animal Health actually has a recognition of community animal health workers as paraprofessionals. And I'm just sharing here an event that will take place on the, if I'm not mistaken, 22nd of October. So to finalize, community, they are so important to lead and engage in rabies prevention and control. It's actually the communities that need to demand to the policymakers that their communities are protected against rabies, and involving them from the beginning is therefore absolutely essential. And I would like to thank you very much for your attention and pass it back to Kirsten. Thank you.
Great. Thank you, Katinka, for that insightful presentation and also highlighting the launch of WOA's guidelines for the event on October 22nd for community animal health workers. That's a great one. And VSF International was also involved working with WOA on these guidelines. So it's quite a great achievement. So something that's also worth checking out. So thank you for that. And so with that, I will introduce our next speaker, Scott Zari, our veterinary director here of companion animal programs at VWB North America. So Scott holds a Doctor of Veterinary Medicine from the University of Calgary, specializing in ecosystem and public health, and a bachelor's degree in microbiology and immunology from McGill University. He previously served as Chief Veterinary Officer for Manitoba, where he managed animal health and welfare programs, aligning them with public health and agricultural sectors. His international experience includes working with the World Organization for Animal Health in Southeast Asia on large-scale disease control programs for foot and mouth disease and rabies, as well as an internship with WOA in Paris. So with that, over to you, Scott.
Good morning, everyone, and good evening, wherever you're joining us from. I'm going to start with more of a North American context to rabies and some of the models that are being developed here over the last decade and even more recently. There we go. Before I begin, of course, I'm based in Winnipeg, Manitoba, and I like to begin by acknowledging that I am situated on Treaty 1 territory, the traditional territory of the Anishinaabe, Cree, Oji-Cree, Dakota, Dene peoples, and homeland of the Métis Nation. And I want to recognize Truth and Reconciliation Day, which is occurring on September 30th of this year in Canada. So rabies status in Canada, just as a starting point for those of you who might not be living in Canada and the US right now, our main rabies reservoir is in wildlife. We do not have an established reservoir in domestic dogs. And as such, the risk of rabies to humans is low. It's not zero. We do have cases over the decades in humans, but predominantly the risk is associated with wildlife. But of course, I want to share more of a regional example in Northern Canada and US where that's an exception. When we're talking about wildlife reservoirs, the main common reservoirs are bats, raccoons, skunks, and red and Arctic foxes. And that's going to be very much regional based on where you are in Canada or the US. Here, I'm based in Manitoba. Our main rabies reservoirs are going to be skunk centrally and then Arctic fox in the north. And rabies outbreaks in Arctic foxes is not an uncommon occurrence. We've had here around Churchill last year an outbreak in rabies, and as well as in Northwest Territories, there is occasional sporadic outbreaks even as of last year. So when we're talking about rabies, I want to kind of give you a very kind of case example of how some of the risks arise in northern Canada and northern US with Alaska and some of our northern territories, and some of the models that have been developed to support the rabies risk there. So what is the rabies risk? Of course, as I mentioned, wildlife reservoirs exist here for rabies in our continent. In northern Canada, in Alaska, it is mainly going to be Arctic foxes. And of course, the use of dogs in many Arctic communities, they have a strong cultural belonging. They've been used for sled animals, they've been used for protection, and of course, companion animals. Many dogs are still kept outside. And so there's an increased opportunity for interaction with wildlife. And of course, that poses a more significant risk when dogs are unvaccinated. And of course, when they might come into interaction with a rabid Arctic fox, as an example. And here's a really good photo to represent that. It's a Norwegian case example, but something like this interaction wouldn't be uncommon for northern Canada and the US and the circumpolar region. And so you have a dog who's predominantly living outside with the household, and then of course a rabid fox loses its inhibitions and will inevitably in some cases bite dogs outside and lead to rabies infections in those dogs. And of course that then presents a public health risk to those communities if that dog isn't vaccinated. And so just as an example, between 1947 and 2017, there was actually almost 950 cases of rabies reported, mostly in Arctic fox in northern Canada. So before I move to the models, the innovative models that we're looking at to really support communities and some of the risks they deal with, we have to look first at what are some of the challenges to accessing rabies vaccination. Well, like many countries, rabies vaccine, for good reason, is regulated both at a government level and our vet licensing board level, government, public health in some jurisdictions. They're going to regulate the ability to distribute the vaccine, so specify who can actually receive and administer the vaccine, and then also requirements, legal requirements for rabies vaccines in some cases, based on which public health department you're working at, the provincial or the state level. And then most licensing boards, of course, have their own bylaws, which dictates who can actually administer rabies vaccine. And most of the time, that is for veterinarians with veterinary technicians with oversight. Where that becomes a challenge, of course, is in the northern circumpolar region, as you might call it, in northern Canada and Alaska, where access to vet care is very limited, based on the fact that there are limited veterinary clinics, limited veterinarians in remote rural areas. And so accessing vet care and thereby accessing rabies is an actual barrier. And so it does pose a risk for some of the case examples I was sharing with you, where there's interactions between rabid foxes and dogs who are living outside. And so where in Canada and the US, some of the long-lasting programs that have been developed are the lay vaccinator programs. And that's essentially overcoming the barriers, the regulatory barriers to administering, accessing the vaccine. So it's essentially allowing non-veterinarians, non-vet techs to be trained, to be regulated to administer rabies vaccine. It seems like a very simple model, but it isn't. You really have to work with your association in your respective province or state, and you have to work with the regulatory body to be able to overcome the ability to access the vaccine and overcome who's allowed to administer it. And so in these programs, they're able to overcome those barriers. And a good example, one of the oldest programs that I'm aware of is the Alaska Lay Vaccinator Program, which has been going over for a decade now. And it's a partnership between the Alaska Native Tribal Health Consortium, Public Health Department, and State Veterinarian. And now here in Canada, we're very proud to say that we've got a growing lay vaccinator program that is being spearheaded here in Manitoba and Northwest Territories, and looking to see how that could really spread its way across Canada. And I think the concept is very simple. It's really removing barriers to rabies vaccination for communities that really do not have access to veterinarians and may never have access to veterinarians. And so it's really flipping that model paradigm on its head to say that we are trying to overcome the barrier for logical ways of communities being able to access rabies. And the last model that I want to talk about is the kind of growing efforts of community veterinary outreach programs in North America. There's a number of programs that are being led, and one of which is, of course, we have a Northern Animal Health Initiative here in Vets Without Borders, and the foundation of these programs is really providing communities with access to vet care, whether if they have geographic remoteness that stops them from being able to access vet care, and of course rabies vaccines. So from a VWB perspective, some of the pillars that we value and would encourage many organizations when they're developing their community outreach program is, of course, number one is making sure it's a community partnership. Our NAHI program is always based on invitation, and then we develop an agreement with Indigenous leadership to make sure that they support this type of programming in their community. Number two, it seems like a very obvious statement, but you need to develop long-term shared community goals, which need to have a real community health and safety basis. It can't simply be about the animal-centric element. It has to be prioritized by the community. And of course, communities are concerned about their residents as well as their animals. But when you're developing these goals, they have to be recognizing that they have to be founded on community health and safety as well as animal health and welfare. Knowledge sharing, a key component of our program is really making sure that we're sharing knowledge with communities. We've got an education program for rabies bite prevention, for responsible pet ownership. And so key component is making sure communities have access to information, and capacity building is an obvious one. We want to make sure that when we're not in community, that we're leaving capacity behind. We have our own lay vaccinator program, and we train residents in how to vaccinate animals in their community. And last, they have to be data informed. If you're developing a dog population management program with communities, you have to make sure that you're accomplishing your goals with data. Dog population census, dog vaccination numbers, spay-neuter numbers, those are all critical when you're developing a long-term plan with communities. So two models that are have been established here in North America to overcome rabies vaccine risk, rabies risk and vaccine barriers, lay vaccinator and community vet outreach. And then moving forward, I think there's a lot of room for growth in this area, and where I think many states and provinces need to move towards is creating a strategy that really creates solutions to vet access and, of course, public health issues that are associated with vet access. We still don't have a community animal health worker model in the US and Canada, where I think there's actually a very good reason to have that. I think that's another area that we can spend more time working with communities on. And of course, it has to be community led to meet their specific needs. There also has to be some forms of education opportunities that bridge the gap between rural, remote, and Indigenous students with veterinary colleges. Some new models are growing here, even in Canada, with Guelph having partnerships with northern universities to graduate veterinary students at some of their universities there. And then last but not least, telemedicine, I think, also is another way that we can use to encourage and bridge the gap with communities, not necessarily through a rabies administration, but of course accessing information through a telemedicine line about rabies bite prevention and risk, and then other needs of the community around animal health. And in conclusion, of course, just reminding everyone, wildlife is the major reservoir for rabies in Canada. Northern communities have very unique challenges. We have innovative models in progress, but they need to be more widely implemented, community-led, and of course funded. And then last but not least, there's a number of different future models that I think can address this in a more sustainable way. Thank you.
Great. Thank you, Scott, for that presentation. I would like to just remind everyone before I introduce the next speaker to also please enter your questions in the Q&A for us to answer in the Q&A session after the presentations. So with that, I would like to move on to our next speaker, Johnson Limo. So Johnson is the founder and president of the Meru Animal Welfare Organization based in Arusha, Tanzania. He has 14 years extensive experience working in the field of animal welfare in Tanzania, and he's on the advisory committee for the Coalition for African Animal Welfare Organizations based in Cape Town, South Africa. He's also a Tanzanian representative for the International Organization for Animal Protection, an NGO affiliated with the United Nations Department of Public Information and the United Nations Economic and Social Council. So with that, Johnson, I will pass the floor over to you.
Good morning, everyone, and good evening, everyone, according to the time of your country. I would like to thank you for giving me this opportunity to give you this wonderful sharing, this experience of the activities which I've been doing, especially in the community of the pastoral in the Maasai. Meru Animal Welfare Organization have been working in the Maasai community, where most of the people living there as a pastoral, which are keeping a lot of the cows, and most of the dogs were living there by, all of them are working animals, which most of the major works which they do, it's actually protecting the animals, especially when they go for grazing. And the district which we are working, it's Meru and Simanjiro. There are two districts which we are working currently, and we make sure we work on the rabies campaigning yearly, and we've been doing it for more than 3 years now, continuously. And we have come up with a good module according to the pastoral community who are living there. We've come in with the module of boma-to-boma vaccination, the house-to-house vaccination campaign, which is able to helping us to make sure that we reach the 70% of the animals around that area. And these modules we have come up with, we're combining of the paravets, veterinarian, and we call it animal welfare champions, the people who are living in the community. And this has been giving us a lot of the successfully of doing the more high percentage of reaching more animals, because this is animals who are being working in rural areas, in the forest, in the place where they are actually animal going for grazing. So this is community animal health workers or animal welfare specialists, animal welfare champions. They help us a lot, especially identifying the areas where we can reach the dogs during that time. And actually we have been having the program of also educating the children during the rabies vaccination campaign to make sure these are the most of the people who are being affected by the rabies. They are high percentage, especially the children, normally when they go to the schools. So we started by educating them to understanding about the disease itself and how to protect themselves from the disease. And this is also helping us also because helping the knowledge to the kids to understand how also to protect themselves from the rabid dogs. But also we have been doing the household bomber-to-bomber vaccinations. And you can see here we have the children's, and also we have these animal welfare champions. They help us to catch the dogs and also to make sure the dogs are also identified and also vaccinated. Also for the dogs which actually they don't have, we found some areas difficult to catch them. We are using the dog nets, which is helping us also to make sure that we catch them and vaccinate them without leaving any dogs around. Also, we have been doing for the cats as well, because you know the cat is also bringing the rabies into the community as well. So we actually make sure that during the campaign, we make sure that we vaccinate the cats, all of them, together with the dogs. Here you can see an example of the animal welfare champion young boy, which we actually already trained him how to catch the dogs and bring the dogs to the clinics. You can see him how he participated in our clinics, bringing the dogs to make sure the dogs are vaccinated. So this is very important to make sure that when we go to these areas, we make sure we have a champions which we have already given them the knowledge and training them, especially not only handling the dogs, but also make sure that they have understanding the challenges of the rabies. So it's also helping the kids how to catch the dogs and bring them to the vaccinations. Also, because of the challenge of the language barrier, the animal welfare champion, they help us a lot, especially when we're sending the message to the community, especially when the training. So they help us to make sure that the people are understanding on their own language, and to make sure that they know out, and also why the reason in the importance of this activity of rabies vaccinations. This module of moving to the bomber-to-bomber have been very successfully, and it's helping us a lot, because some of the houses, when you normally go, some of the houses, if they have 5 dogs, you can tell them when they go for grazing the dogs and leave 3. So you vaccinate them, then the next day you go back, you vaccinate them. The another one who vaccinated will go for the grazing with the cows, so that we are vaccinating a high number of the dogs without left anyone behind. This is the animal welfare champions, and most of them high percentage of. This is the animal welfare champions which we normally train in the community, and most of them, mostly we focus with the women's because it's already in the community. We believe that training the women in the community, you train the community itself. So this we give them like a highlight, and they help us about the spreading the knowledge in the community about the prevention of the dogs, of the rabies, and also helping us a lot to make sure that they have a lot of the knowledge about the animal welfare. Also, we have been engaging the livestock colleges and also universities for the practical sessions and also training to make sure that we raise more ambassadors, to make sure that they're helping us during the vaccination campaign. Also, we have a challenge of the stray dogs. Actually, we normally make sure that we are using you can see, for example, we are using the animal welfare champions to make sure that they're helping us to catch these dogs, to make sure that they are vaccinating, and also they're getting the treatment to make sure they are protecting the community itself. So you can see actually in Tanzania, or in the area which we work, we can give the percentages of the dogs. The 100 out of 100 percentage, the 70% of the dog is a roaming dog, 20% you can call it a stray dog, the one which doesn't have owners, but the 10% we can say the dogs which are kept in the compound, living in a compound, treated well and all that. So this working with the paravets and the local government and the community leaders and the animal welfare champion, we are able to reach this 70%, which is high population of the roaming dogs in the community. That's the end.
Great. Thank you for that presentation, Johnson. So with that, we're going to be opening the floor up for our question and answer period. There have been questions coming through in the Q&A chat box. If you have any more, please continue to go. I will direct them to the appropriate speaker as we go. Scott, maybe we'll start with you. So for the question is, for the lay vaccinator programs, would the local governments or federal government be funding these?
Great question. In Canada, the lay vaccinator program has actually just been established this year as pilots in Northwest Territories in Manitoba. And so currently there isn't a funding program with government in place, but I do think it's really part of a phased approach where as the program rolls up and gains interest and government understands the priority of it and it's rightfully conveyed, I do see it as a future element for government funding, but currently is not, and naturally is one of the biggest gaps in these type of programs.
Thank you for that answer, Scott. I'll move over to the next question for Katinka. Katinka, in your experience, what are the most effective strategies for engaging local communities in vaccination efforts, especially in regions with limited veterinary infrastructure?
Yes, thank you for this question. What we see that's very important is, first of all, for the communities to be aware about the problem of rabies, to have the right information. They know what the disease is, because often also there are kind of misconceptions with regard to vaccinating dogs. For example, that they will lose their smell, that they will not be good hunters or good guard dogs. So it's very important to demystify these kind of ideas. And then the second one is to engage very much the young people. Here we have seen, for example, in Zambia, we have done dog ecology studies, and it showed that often when the government vaccinates during the week, the turn up is very low because people are busy with other activities. But it are the children, the ones that have the closest contact to the dogs. And when you organize these campaigns, when the children are available, for example, during school holidays, the turn up is much, much higher. And also we find that often in a family, it are the children who are able to catch the dog, to manipulate the dog, to take it on the leash and take it for vaccination. So it's essential to go through with the children. I think, therefore, education programs in schools, for example, in some countries, rabies has been integrated in the normal curriculum. Another example I want to give is from Thailand, where when highly pathogenic avian influenza first broke out in 2004, 2005, they developed at community level Mr. and Mrs. Bird Flu. They selected a man and a woman in communities, and they provide them with training and information so they would spread this information. The same idea was to have Mr. and Mrs. Rabies, so that people in the community are being trained and they can inform the rest of the community. Thank you.
Great. Thank you, Katinka. Just because we have several questions, I'm going to keep going, and then we'll engage a little bit more in some open dialogue. So the next question is for you, Johnson. So Johnson, your work in Tanzania has shown great success with the use of mobile rabies vaccination clinics. What have been the biggest challenges that you've seen in maintaining these clinics, and how have you adapted to ensure their continued effectiveness in remote areas?
Thank you for the good question. Actually, the big challenges have been, number one, have been resources. And then secondly, we actually have been the challenges, especially during the animals, according to the movement of the areas. During the drought season, animals are moving different areas for looking for the grass. And as I mentioned earlier, these dogs are working for escorting these grazing animals to protect them from hyena. So normally, actually, it's a challenge when you go for one area and then you find the people have moved with the cows and with the dogs to the another area looking for the grazing. So that are the challenges. But to make sure that it's becoming the sustainable, we're also engaging the community itself and also the local government, which also they will take the lead when we leave the project that we're finding for the sustainability. And also we make sure that when people understanding, have the knowledge, have the awareness about the rabies themselves, and it become the sustainable way.
Thanks, Johnson. That kind of echoes a little bit also what Scott and Katinka were saying in terms of sustainability and funding and the buy-in from governments tied with the community education pieces and activities. So it really helps paint that full picture of the different levels of involvement that's needed from the stakeholders across each country. So moving on to the next question. This one is actually for both Johnson and Scott. So for Johnson and Scott, what is the value of engaging children in rabies education initiatives? So maybe first I'll pass it to Scott since Johnson, you just went, and we'll go back. And I think actually it'll be interesting to hear your view on that, Katinka, as well.
Yeah, that's a great question. And I can only say what my experiences are from the Vets Without Border lens is that in our programming, inviting children into the program, both in terms of when we're doing outreach and when we're delivering the education program, actually fundamentally brings a lot of energy. It really reminds us of why we're supporting such programs and why we're working with the community. And they actually act as a conduit for the rest of the community, sharing the information that we've shared, sharing information about our participation in programs in the community. So they really act as that kind of champion in the community. And of course, many children are at risk from dog bites, as an example. And so, of course, you want to be able to share that information directly to the children who are at risk. And they're just a lot of fun to interact with. Yeah.
On my side, I think it's very important to engage the children on the rabies education initiative, because actually this is the most people who are spending a lot of the time with the dogs. And when it's coming to the relation of the dogs and the children, is very close, it's very high. Even on our clinics, normally I can say 80% to 90%, it's the children who always bring the dogs to the vaccinations campaign, to the clinics.
Go ahead, Katinka.
Yes. Now, from my side, in my talk, I mentioned the animal health clubs in Sierra Leone, and they were instrumental. These were started at community level, so school children would form these animal health clubs, and they would initially address mainly rabies. Afterwards, they also were looking at other activities with communities, like, for example, garbage control, feeding of livestock, etc. But the initial thought was exactly to address the children, to involve them, and they are the ones that will also communicate with their parents and teach their parents about rabies.
That's great. Thank you. So moving on to, I guess, the next question. This one is directed towards Scott. So with Alaska having the lay vaccinator program going on 10 years, has there been any issues or pushback from the veterinary industry or governing body?
Great question. I'm not the authority for sure to speak to all of the Alaska experiences with the lay vaccinator program. I can speak to the programs that certainly starting here in Canada with more ease, with the Manitoba lay vaccinator program having been started this year. I would say there hasn't been serious pushback, and really that's because there needs to be an engagement process for developing these models with the vet community. It can't just be a steamroller saying that this is important and this is why, because you can't bring people along in that process. So I'll certainly give credit to members of the provincial government here and stakeholders in Manitoba and Northwest Territories for really engaging the vet community over a year-long process before it actually went to a bylaw referendum vote with the vet community and was ratified earlier this year.
Great. Thank you, Scott, for that insight. With that, I'd actually like to pivot the question to one that was put in the chat, Katinka, that you answered typing in the chat, but I think it's a great point to have a little dialogue between the three panelists here. And it's really looking at what are the possible challenges involving community animal health workers in rabies control? So all three panelists, you did talk about community animal health workers being kind of a key element in the multifaceted approach to rabies control. So what are those possible challenges and what are ways to overcome them? So I'll pass it to Katinka first. I know you did write a little bit about this in the chat, but it'd be great to hear a little bit more.
Yes, thank you. Well, initially the community animal health concept, it was developed through various projects. And still today we find that in many countries, there are small projects where they start actually developing the community animal health concept. They do the training, the selection of participants, etc. So it has often been very much linked to livestock diseases mainly. So that has been the initial focus, that actually the community animal health workers were selected as livestock keepers or livestock owners that were familiar with dealing with production animals. And most of the focus was on actually diseases and animal production, nutrition, etc. But now that we move more into rabies, possibly the profile of the people that would be the champions dealing with rabies might not always be the same as those that are mainly dealing with livestock diseases. And as mentioned before, young people and especially children or young adults, these are the ones that have the closest contact with dogs and cats. And that kind of persons need to be, that it might be a slightly different profile that we select to be trained as more the champions for rabies. But certainly, I think identifying these differences, this challenge can be overcome. And I think the World Organization for Animal Health has done a great job in recognizing the concept of community animal health worker as part of the delivery of animal health services. And I think this has been a big step forward, so that also they are actually, they can be part of the delivery of services. And here vaccination, we know that dog vaccination is the best way to control rabies. And this is an area where the right vaccinators need to be trained. I just want to mention very briefly here the 8 teams that were developed in Bali. And as you all might know, that rabies was introduced into Bali in 2009, before the island was completely free of rabies. And here youngsters were trained to actually catch dogs with nets on motorbikes, and they were a magnificent system to have these teams, these 8 teams, working side by side with the vaccinators. So just to share that experience. Thank you.
Great, thank you, Katinka. Johnson, would you have anything to add to what Katinka was saying?
Yeah, actually, I would like to add up on most important for these animal welfare champions of this, because actually at the end of the day, this is the people who are going to normally speak into these community meetings, especially when, for example, when it's coming, the incident when children is bited by dogs, they normally what the government will, they'll run quickly, they'll say, we are coming to shoot the dogs, but that is not sustainable solutions. But when we have these people's champions or animal welfare peoples that can go to the meetings and speak and say the best way how we can handle the rabies vaccination campaign in that area. It's like having an ambassador in the community.
Great, thanks, Johnson. I think that's an excellent point, and a key role of the community animal health workers is to really be that voice and that ambassador in the community, as you were saying. Over to you, Scott.
I think the only thing I'd add to the conversation is that we actually have to set up community animal health worker models, lay vaccinator models, any type of model with success. I think the reality is it involves ensuring that they have the success in terms of resources and training, and that they're backed up by government support. Many times the work of these different models are a public good, and sometimes we forget that they contribute to a public service. And I think slowly governments are becoming to realize their necessity as a public good. And I think to unpack some of the challenges that community animal health workers overcome, they have to be enabled with the right resources to do that.
Definitely. Thanks, Scott. Yeah, and it brings that whole piece of advocacy into the picture of advocating to governments as well. So that is great. So with that, we're going to wrap up our wrap up the webinar. So before that, I would just like to pass it to each panelist just to give a quick highlight, a key piece, a takeaway that they would like everyone listening to take away from this webinar. And then after that, we will wrap up and follow up by sending the link to the video and the replay for the webinar tomorrow. So with that, I'll pass it back to Katinka to just say a final takeaway message.
Yes, thank you. Now, I think as also to have political will and the resources for rabies control are essential. Here, I think the communities, the voice of the communities need to be heard. So therefore, the communities need to be aware of the importance that actually the services come to them to vaccinate their animals, that they also bring the animals. So to have their voices heard, and as we know, and communities are also the voters. And I think the local governments play here a very important role. So for the communities to advocate with the local governments of the importance that their families and their communities are protected against rabies. Thank you.
Thanks, Katinka. Over to you, Scott.
I think Katinka said it best. In the Canadian and US context, solutions have to be community driven for them to be sustainable. So if there's anything that I shared in my overview today, it's just reminding us that the communities have to be the leading voice of developing the solutions, with support, of course, with partners like VWB and government.
Thank you, Scott. And Johnson?
Mine is to argue to continue engaging more children in these campaignings, to make sure that the knowledge go throughout and they grow up with the knowledge of understanding the rabies. And this, they will become to be very strong people in the community. They will come to change. They will become a game changer of the rabies, because they will understand from the beginning. So when it's coming to they grow up, they will challenge from their families and also the community. So it will become the community with the knowledge of rabies. So it's quite easy to push the government and say what you want to do from ABCD. It will become more easier. So I think the key point to make sure that we enforce more on education. We invest more on education and the awareness into the community.
Great, thank you, Johnson. And thank you, Katinka, Scott, all your panelists for your presentations and insightful discussion today. And thank you everyone for coming and participating in this webinar. As I mentioned, just keep an eye out for your email. You'll get a link to the replay and also an opportunity if there's any unanswered questions that you have or that have been put in the chat, we'll make sure to follow up with via email as well. So thank you very much, everyone, for your participation, and we wish you the best for the rest of the day.